A new life begins. This is always an exciting time for the family. This special event happens 300,000 times a year in Canada. Although most newborns have normal hearing, about 1,000 are born with hearing loss each year.
Most children with permanent hearing loss are born into families without a history of people with hearing problems. For many of these children, a review of their medical records will not reveal that they are at risk for hearing loss. In order to find every one of these children, it's important that all newborns be screened for possible hearing loss. Without detection early of hearing problems, the child is at higher risk for long-term language problems.
Language is necessary for communication, a key part of our everyday lives. Since an important period of language development occurs in the first 3 years of life, early identification of hearing loss is essential. These first few years of language, social, and emotional development can be lost and never regained if a hearing loss goes undetected. You may wonder how a baby's hearing can be tested at such an early age. Hearing specialists now have the technology to screen babies' hearing safely, quickly, and effectively, even a few hours after birth. There are 2 main methods of testing. The test that is done and the type of equipment used will depend upon where the newborn is screened. One of the methods used to screen babies is called otoacoustic emissions, or OAE. A small earphone is placed in the baby's ear and they hear a quiet clicking sound. A microphone picks up an echo from their inner ear. When the computer detects this echo, we know that the baby's hearing should be normal. It only takes minutes to test each ear. Another method, the auditory brainstem response, or ABR, involves placing 3 sticker electrodes on the baby's head and neck. These electrodes measure the brain's response to quiet sounds presented through the earphones. The signal is measured and analyzed by the computer, which then displays the result. This test takes approximately 5 to 15 minutes to complete. Neither of these tests causes any discomfort. Babies usually remain asleep during testing. In fact, test results are best when a child is sleeping soundly.
Approximately 1 in 10 children do not pass their first hearing screening. This does not necessarily mean that they have a permanent hearing loss. Many factors can affect our test results, including normally occurring debris in the ear canal or a child being too restless during testing. What it does mean, however, is that the child should have their hearing rescreened either before they leave hospital or at an arranged outpatient appointment. These screenings will help us determine the children who need to go on for further testing to either identify or rule out hearing loss.
As physicians, we check many things with newborn babies, and as ear specialists, one of the things that is quite important, of course, is hearing. Hearing in newborns sometimes is something that's easily missed, it's not easily seen, and it's something that is obviously very important in the early development of the child.
Our son Stefan is a wonderful 8-year-old boy, and he's profoundly deaf. He uses sign language. He's doing really, really well right now, but he wasn't diagnosed as being profoundly deaf until he was about 2.5 years old. The consequences of that late diagnosis were pretty tremendous for the family. We, first of all, experienced tremendous guilt. And I think of how is it possible that I didn't realize for so long that my baby was deaf? It's a pretty important piece of information, and I thought I knew everything about him, and I didn't know that. And I think about the times when I would sit in the dark in his nursery and sing him lullabies, try and comfort him, and he maybe didn't know I wasn't there. He didn't know why I wasn't coming, and he kept on crying. And it's pretty hard to realize that you miss something so fundamental about your child. Objectively speaking, I can understand why I didn't, because we'd walk into the room and he'd feel the floor vibrate and he'd know we were coming, or he'd catch us in peripheral vision, or he'd smell my hand cream, he'd catch the shadow or a slight breeze. He still does that. I mean, he still turns around when you walk into the room, and it's not that he hears you, it's just that there are all these other clues he's got. The frustration that Stefan experienced and we shared with him is pretty tremendous. He went all the way through the terrible twos without any means of communication. I've got two younger kids, and they could communicate a lot. I realize now it's amazing, poor Stefan, what he had to suffer. So there was just so much frustration he experienced with not being able to communicate with anybody. And then he has language delay that affects his abilities at school and learning to read and to write. If you don't have language, you can't read and write it. And he manages to stay only a year or two behind grade level. And we're hoping he catches up, but it's an amazing struggle, and we wouldn't have had anything like that kind of struggle if we could have started giving him language at age 0 instead of at age 3. I would just so like to encourage everybody to have babies tested so that no other families and children go through what we went through with Stefan in those early years.
All children have the potential to lead happy and successful lives. A child with hearing loss will get a head start in life through a quick and simple screening soon after birth, in the hospital, at home, or in a community clinic. A newborn hearing screening is the first step in assuring hearing health. But it is also important to be aware of your child's communication progress throughout their childhood. Hearing can change over time, affected by childhood illness, ear infections, or extreme noise. If you have concerns about your child's hearing or language at any time, contact your family doctor or an audiologist or a speech-language pathologist in your area. Taking a few minutes now can build a lifetime of good communication.
And as you can see, she passed the test. That's great.
The funding for this educational video was provided by the Hearing Foundation of Canada, the Knight, Bain, Seath and Holbrook Spirit Foundation, and the Government of Ontario's Infant Hearing Program. The video was produced in cooperation with the following organizations: the Nova Scotia Hearing and Speech Centres, the Dalhousie University School of Human Communication Disorders, the University of Calgary, the IWK Health Centre, Mount Sinai Hospital, and Hydro Kids Daycare.